Thank you so much for joining us today. There's a video that's circulating. It's unfortunately full of a lot of misinformation, and it seems intent on creating associations with MAID that are negative and inaccurate. We want to address that, and we want to talk to you today to learn a little bit more about what MAID in Canada actually looks like, and hopefully bring some clarity to our audience today.
Yeah, it's a pleasure to be here, and I thank you for that, because I am really troubled for two groups of people specifically, and those are patients who are considering having an assisted death, that they might be afraid that this is true, and absolutely much of this video is not true. And the other part is for people who have lost loved ones, who have chosen to have an assisted death, and I worry that they might think that their loved ones suffered at the end, and in fact they didn't. So I'm really pleased that we can go through some of the details of that to clear up any misunderstandings.
Could you share with us a little bit more about what MAID looks like in Canada, what the criteria looks like, what the requirements are, and a little bit about the safeguards as well?
Sure. I mean, first of all, everyone has to be over the age of 18. So it's really important to know that adults do MAID or are eligible for MAID. They must have Canadian health insurance. So that's really important as well. Canada is not a destination like Switzerland where people might be able to come from somewhere else and get an assisted death here in Canada. It's really important to know that a patient must initiate their request themselves. So it must always be patient-driven, and a patient must ask for that assessment themselves. They're assessed by two separate clinicians, and those clinicians might be a nurse practitioner or a physician. When we do the assessment, we have to make sure that they meet one of three eligibility criteria, and those are: one, that they have to have a curable illness, disease, or disability. The second criteria is they must be in an advanced state of irreversible decline in capability. Thirdly, they must have intolerable suffering that they cannot relieve under any means available to them. So they must have considered various options like medication, physiotherapy, occupational therapy, disability support, palliative care, many things to relieve their suffering. Then the assessor has to figure out whether their death is reasonably foreseeable as a result of their illness or their decline. If their death is reasonably foreseeable, then they have certain safeguards for their procedure. And if they do not have a death that is reasonably foreseeable, they have other safeguards. Throughout the interview, we have to assess whether someone has the capacity to make the decision about an assisted death. So they must be able to reason between two options, explain to us in detail about why they would choose one option versus another, and they must express that they understand that information that they've been given and they've considered it. If there's any possibility that we think that someone may not have the capacity to make a decision about an assisted death or about their healthcare decisions, we have to engage another expert who can do a formal assessment of their capacity. There's a lot of detail that we have to elicit as clinicians, but also a lot of information that the patient has to provide, showing that they are autonomously seeking that information, that they have not been coerced into that decision, that they are not influenced by other people in making that decision.
In the video, there is reference to a specific medication used. It's called sodium thiopental. And there's mention of an anesthesiologist in the United States who has some issues with this medication in particular and speaks about it in relation to the MAID protocol here in Canada. Could you share with us a little bit more about your thoughts on that? Any comments that you have?
That was a very strange thing to me. I don't understand why they would invite an American anesthesiologist who wasn't involved in developing the protocols in Canada to appear in front of the Senate committee. That was just perplexing to me. I think that we need to stop talking about sodium thiopental and Dr. Zivit, because really we don't use that medication, and that is an anesthesiologist who does not practice in Canada. So the medications we use in Canada are three important ones. The first one is called midazolam, and that is a relaxing medication. It's similar to Ativan that many people have taken for anxiety, and it's used quite often in anesthetic in the hospital as well, because it helps people relax very quickly. The important part of that too is that it causes what we call retrograde amnesia. It allows people to forget the few minutes that happened just before. So if someone has experienced a difficult intravenous start or anything like that, they would forget that. So it's really nice, and it keeps people very calm. Following that medication, we give them propofol, which is a general anesthetic drug that most people who've had a general anesthetic will have experienced before. It's a very quick-acting medication, and it puts people into a coma very, very quickly. So during the coma, usually our patients who are having an assisted death with this process, they have an overdose of the propofol and they'll stop breathing. So they'll often die when they're experiencing that medication. There is a third medication that's used. It's called rocuronium, just in case the propofol hasn't particularly been effective. But most of us find that by the time we add the rocuronium at the very end of the process, that people have died. The protocol is very scripted, it's very specific, and it's used right across the country. So it is the same series of medications right across the country. I should add that there's one single medication that we sometimes use called lidocaine, because sometimes the propofol, the white anesthetic medication, can sting their veins. So sometimes we use that in between. But I do find that in my experience, most of the time people are so relaxed and so sleepy with the midazolam that they don't feel anything. So those are completely different medications and they lead to a very peaceful death. In fact, we have evidence that there is a peaceful death and we have evidence that there is no drowning. The evidence comes from an autopsy that was done on someone who had an assisted death and chose to donate their lungs. We looked at the autopsy findings were showing that there was no sign of drowning or impairment of the lungs of that person who died from assisted death, using the medications that we use all the time for assisted death in Canada. To be clear, those medication sequence that we have provided is used by every province and territory, and all clinicians who do an assisted death in Canada use those medications. I was very happy to see that Dr. Tim Holland disputed some of those myths and clarified the medications that we do use in Canada. And those again are midazolam, propofol, and rocuronium.
There was something quite upsetting, I think, for many people to hear in this video as well, which was discussion of the Nazi euthanasia regime and speaking about that and also speaking about MAID in Canada. Can you share any comments that you have on this?
Yeah, well, that was absolutely terrible. I mean, the Nazi occupation and the annihilation of so many millions of people, that was horrific. And the idea that that would ever be equated to assisted dying in Canada is just terrible. Canada has a very, very strict law, which is patient-driven and patient-centered. It's the patient that asks to die because they are suffering, because they have an incurable illness or disease. They see the trajectory of their decline. They anticipate their death, and they are in extreme suffering. They are asking for it. It is voluntary that their request for an assisted death, and to have medical assistance so it's done properly, so that it's done well, so that it's done peacefully, so that it's done gracefully. It's completely different context, and I think it's terrible that these things were associated in the video.
Mm-hmm. Absolutely. Any sort of comparison between a patient choice-led healthcare option to the horrors that occurred during the Holocaust, just any sort of marrying of those things in any way is absolutely unacceptable. In the video, Ms. Sheren mentions that the Fraser Health Authority in BC will not hand over autopsy reports to families. Can you explain why this is legal and explain patient privacy principles?
Patient privacy is a fundamental aspect of our healthcare system in Canada. Your records as a patient are confidential. They are between you and the clinician that you have seen. If you choose to share that information, it must be explicit. And in fact, in most cases, it must be in writing that you want that information shared with any other individual. It is a fundamental part of the way we are trained. In fact, even to renew our license, I have to do privacy training to be sure that I know how to protect that individual's right. So it is universal with any healthcare interaction that one would have in Canada. Those patient records are yours and yours alone. So when a patient dies, or when a patient moves, or when a patient's in the middle of a healthcare crisis, the patient family, the patient's spouse, the patient's friends do not have access to those records unless it's under the explicit permission of that patient. We have to hold on to those records for up to 16 years after a patient dies, or after a patient, we lose contact with that patient. So it's very, very tightly controlled. Following a patient's death, it's very difficult to get access to those records because the records are actually the property of the patient themselves. So unless there's an explicit permission for those to be released following death, we can't do it.
Thank you. And what I'm hearing is that this applies across all areas of healthcare. This isn't a MAID-specific thing.
Oh, no.
This is not
MAID-specific at all.
to anything.
It's anything in your medical records. We do, if anytime in healthcare that I've ever been involved with, sometimes we get concerned parents, concerned elders, concerned siblings, concerned spouses who want to know what happened in that encounter and can they have a copy of their records. It is not possible. I cannot give that out. Never have been able to, never will be able to.
There seems to be a lot of misunderstanding when it comes to the access to palliative care of people who are also accessing MAID. Can you share a little bit about what that typically looks like and what some of the statistics point to?
Yeah. Well, palliative care is an interesting aspect of healthcare because there is still a little bit of understanding about what palliative care entails. And really for many patients, this is a great therapeutic benefit because when they are suffering intolerably, palliative care experts can actually provide medications, supports, ideas, combinations of activities that people can do to relieve their suffering. And so we do find that people who want to or are considering having an assisted death, they do also have palliative care involved in their care. Palliative care will relieve their suffering as much as they can, but still patients may want that autonomy to decide the time and date of their death. They still might want that. We know from the statistics that's gathered by Health Canada, especially in the 2022 report, we haven't yet got the 2023 report, but we know that a large number, up to 77% of people who have an assisted death have been offered and have experienced palliative care. So we know that those people are accessing different supports to relieve their suffering, and I think that's fantastic. I really do believe that since MAID has become an option for Canadians, that access to and interest in and understanding of palliative care has actually increased.
And very important that people can speak openly about all of their end-of-life choices, and that includes palliative care. And as we know from the statistics, that often includes palliative care alongside MAID if MAID does become the option that someone chooses.
Absolutely. Absolutely.
There is a specific statement that I wanted to read out for you, and maybe we can discuss what might have been meant by this statement and maybe where some confusion lies, because it seems like there's a few different topics being put into one statement and it might cause some confusion for people. So the statement says, quote, "If we didn't stop that bill by the 17th, children down to the age of 12 years old with parent consent, a 17-year-old could walk into a hospital and say, 'I want to die by MAID.' And guess what? If you try to stop it as a parent, you will be arrested." And that's the end of the quote. Can you share with us any insight you have into what might be happening in this statement here and what these various components are speaking to?
It is a really confusing statement because at the time that this bill was being discussed, we weren't talking about children. MAID in Canada is for someone who's 18 years of age and older. And that is the legislation that remains the legislation, and that was not the topic of discussion at all. I'm not sure where Sheren came up with this particular statement. Certainly there have been Senate committees that have looked at assisted dying in minors, but that has never gone to the point where MAID with mental health has gone in our discussions. So let's be very clear that the March 17th, 2024 bill in Canada was not about people under the age of 18. That is unchanged. Canada only allows MAID for people 18 years of age and older. That bill this year in March of 2024 was about MAID and mental health.
One thing that is referenced and that you spoke about already is some 2022 data that we have, and that's through Health Canada. Could you speak a little bit to the 2022 report that we have on MAID and share with us who's accessing MAID, what's that looking like across the country, and a little bit about what we're seeing in terms of MAID access?
Yeah. Well, MAID access is a little bit variable across Canada. There are slightly different numbers in each province and territory. That is true. What we can say is that overall Canada is approaching the 4% mark. 4% of people who die in Canada, close to that, are choosing to have an assisted death. In fact, this is the number that we expected from the Netherlands. The Netherlands, it's about 4% of people are dying with assistance. So this is not unexpected at all. What we can say is that the average person in Canada that would die with assistance is a 77-year-old with cancer. That is the most common age group, is late 70s, and the most common cause is cancer. We should say that all MAID deaths are required to be reported. In fact, that is part of the protocol that we teach clinicians, is how to report it to Health Canada. You cannot go about as a clinician to help someone with their death unless you are prepared to report that.
Great, thank you. So regardless of where someone is in the country, all of this data is being collected, and that includes things like the underlying condition that a person has. And what I'm hearing is that the majority of people will have a cancer diagnosis.
There's a lot of sub-detail in the reports that we put in following a death. And we know as clinicians that if we do that wrong or we omit to do that, that we are at risk for losing our license or having a criminal negligence file brought against us. We are not aware of any criminal negligence that's ever occurred to a clinician in Canada, but this is the risks that we know we are taking, and we do this very diligently and very carefully.
Mm-hmm. You spoke a little bit about the percentage of individuals who access MAID. We're at about 4%. What we have heard is some concerns that the numbers are rising each year and that more people are accessing MAID in Canada. Can you comment on that? And do you have any insight as to why you think that might be?
Yeah, we can say, and what we do know and what I've experienced is that patients are recognizing that MAID is an option that they want to consider for their end of life. And many people want to consider that, perhaps not use it, but they do want to be assessed. So we know that patient education, patient information, and their reach for autonomy or their desire for autonomy is very strong in Canada. So at this point in time, it's interesting that people do want to know that they have choice, that they have an opportunity, and that they can have such a thing as an assisted death. What we have in Canada is people volunteering to say, I'm suffering, I have an incurable illness, I'm in an advanced state of decline, I want to die at my date of choice with the people that I love and with some assistance so that I know it will be peaceful, dignified. In Canada, we have a healthcare possibility for people who meet very defined criteria. It's driven by the patients, and it is assessed by clinicians who are experienced and who are very careful and thorough in what they do.
The Health Canada data that we're speaking about is publicly available, and there's a very extensive report that anybody can read. You mentioned we're waiting on last year's data. It will be released, and people, of course, can see what things are looking like last year as well.
Absolutely. I think it's actually very interesting reading for anyone who's interested in assisted death because there's so much detail in that report. There's a lot of information that we supply as clinicians to make that report possible, and I'm glad that they're using it in a helpful way so we can explain where are the gaps in access to assisted dying in Canada, but also a little bit more about the people that choose this. We also know a lot more about what kind of supports they had, what disability supports, what palliative care supports, and what kind of decline that they were in at the time of their death. So it's quite fascinating reading.
Mm-hmm. And my understanding is that in early 2023, there were changes. So the next report is going to capture even more data than we've had in previous years.
Absolutely. Absolutely. In fact, I think the Health Canada report is so important that for people who are interested in the facts about MAID, that is the source to which they should turn because that is where the data is. So I think that that is really the best report to get the true facts on MAID.
Mm-hmm. Thank you so much for joining us today. I think what we can really take from this discussion is this focus on autonomy and choice and a patient-driven healthcare decision. And it really brings me back and reminds me of what we've experienced over the past several years, which is patients fighting for access to MAID and fighting for MAID to be a legal option in Canada.
And I'm so glad that you invited me here today, Kelsi, to clear up some of those misinformation that has been propagated by videos and perhaps online blogs and things like that. It's so important that people recognize that their loved one who has chosen assisted death did not drown, did not suffer, but actually had a very peaceful death. They fell asleep during a general anesthetic, they had a coma, and they slipped away. And I hope that that's the sentiment that people will be left with from their loved ones.